Hello everyone, I'm Dr. Yew Yik Weng, Senior Consultant Dermatologist and Deputy Head Research at the National Skin Centre, Singapore. Today, let's discover more about atopic eczema. Atopic eczema is a very common skin condition which causes a dry, itchy and inflamed rash. The term eczema is used interchangeably with dermatitis and refers to inflammation of the skin. Atopy is characterized by a tendency to develop a group of hypersensitivity disorders, namely eczema, asthma or hay fever due to a genetic predisposition. Atopic eczema commonly presents in infancy and childhood, but can also occur for the first time in adults. It affects both gender equally. In infancy, commonly affected areas include the face and outer side of the limbs. During childhood, it usually affects the skin folds such as the elbow bands, back of the knees, and neck. Eczema can also occur around the lips, eyes, and other parts of the skin. In mild eczema, there's a dry, red, and itchy rash, while in more severe cases, there may be oozing, crusting, and bleeding. The main symptom is itch, which can be severe enough to interrupt sleep, causing tiredness and irritability. The cause of atopic eczema is not fully known. However, we do know that genes play an important part, as atopic eczema often runs in families. Alterations in the immune system are also thought to play a role in the development of eczema. The immune system in atopic eczema overreacts to things that do not normally cause any harm, such as irritants like soaps and fragrances, and even allergens such as house dust mite and animal dander. In addition, the skin barrier in atopic eczema is also impaired, leading to dryness and increased skin penetration of allergens and bacteria or viruses. It's important to note that atopic eczema is not infectious, and you cannot spread it to other people. Eczema can flare up through many factors. 1. Environmental factors such as heat, dust, pests, and irritants. 2. Dryness of skin. 3. Being unwell such as having the cold or flu. 4. Teething in babies. 5. Skin infections with bacteria or viruses. Example, infection with the cold sore virus. 6. Food allergy. It's rare for food allergens to cause eczema, although food allergies may make eczema worse in some people. Prevalence of food allergens is highest in young children with severe eczema. Common food allergens in children include cow's milk, hen's eggs, peanuts, shellfish, wheat, and soy. And 7. Stress. The following are important in the skin care of people with atopic eczema. 1. Avoid scratching, rubbing, and picking the skin. This aggravates the eczema and may also lead to unsightly pigmentation, open wounds, and scars. 2. Avoid irritant soaps and detergents. Use gentle soaps or soap substitutes instead. 3. Moisturize the skin frequently. Moisturizers do not cause thinning of the skin and should be applied liberally and frequently throughout the day. When in a dry and cold environment, it's important to keep the skin well moisturized to prevent flaring of the eczema. Remember to apply moisturizers after swimming. 4. Certain clothing materials such as wool and linen tend to irritate the skin, while materials such as cotton are more comfortable for the atopic skin. Treatments commonly prescribed for eczema include moisturizers and topical steroids. Topical steroids are useful in reducing skin inflammation. They are safe if used appropriately. Some possible side effects of prolonged use of steroids include skin thinning. Your doctor will advise you on the appropriate use of topical steroids. More recently, steroid-free topical medications have been developed and are available for the treatment of eczema. These new creams are costly, and your doctor will assess the suitability and appropriate use of these medications. Oral treatments for atopic eczema include oral antibiotics when the skin is infected. Antihistamines are also commonly prescribed to reduce the itch. In severe cases of atopic eczema, other treatment options such as phototherapy or systemic immunomodulators may be indicated. Your doctor will advise you accordingly. Thank you for watching this video. If you would like to learn more about eczema, feel free to reach out to one of our dermatologists at the National Skin Center.